Reaching up to grab a heavy grocery bag can suddenly feel risky when the shoulder joint slips out of place. This anterior shoulder instability often develops after repeated dislocations, making everyday movements feel unpredictable. Non-surgical treatments like therapy and bracing may not provide enough relief for active individuals. The operation aims to repair the front of the joint so it stops slipping out of place. Most people find they can move freely again without the constant fear of the shoulder giving way. You will need to fast for 6 hours before the procedure and pause any blood-thinning medicines as directed. A friend or family member must arrange to drive you home, as driving is not permitted. Please wear loose clothing and bring a full list of your current medications. You will likely undergo a plain radiograph, a magnetic resonance imaging scan, blood tests, and an anesthetic review beforehand. These checks allow the team to see the full picture of your shoulder and help keep you safe. The surgeon performs this procedure using a keyhole approach around the shoulder. 2 or 3 small cuts are made to insert a tiny camera and special instruments. The surgeon carefully reattaches the torn tissue and ligaments back to the bone. Small anchors are placed to hold the repair, with at least 4 points spaced 5 to 8 millimeters apart. If necessary, a small piece of bone may be moved to create a protective barrier. The incisions are then closed with stitches or glue, and a dressing covers the area. You will wake in a recovery ward with a sling and dressings in place. Pain is managed with general medicines, and most people feel noticeably better within a few days. You can usually return home the same day though. Some patients stay overnight. A friend or family member must stay with you for the first 24 hours. Your physiotherapist will guide you through gentle exercises, starting with small movements to prevent stiffness. As comfort improves, you will gradually add stretching and strengthening while avoiding heavy lifting. Your care team monitors your progress closely to spot any early changes. Occasionally, the shoulder may feel less secure or slip out of place, particularly after contact sports. Persistent weakness or difficulty moving the arm should be discussed at your next review. Deep, throbbing pain that does not settle with simple medicines requires an immediate call to the clinic. You should also seek urgent care for fever, increasing redness, or any sudden shortness of breath. Your surgeon and therapist will adjust your plan as you work toward building strength.